All right, everybody, welcome back to the JEMS Report podcast. Excited to be back with you today. Wanted to record a little update and maybe give some more information on the story that we released last week on some information that came out from the FDA on the use of Tylenol in pregnancy. So I reached out to a couple of my good friends. So our medical director, Dr. Sarah Fabiano and Dr. Jeremy Cushman, they're both on with me today. We're going to talk through some of this, but just so this can be a standalone podcast, if each of you would like to introduce yourselves. And I know you've been on before, but this way everybody that's listening and watching can know who they're hearing from.
Awesome. Thank you, Dr. Cushman. I'm Sarah Fabiano. I'm the JEMS medical director, but I'm an emergency physician in South Carolina, and the pre-hospital peeps are my jam pretty much. So that's it.
And I'm Jeremy Cushman. I'm a paramedic EMS physician in Rochester, New York.
Awesome. Well, again, thank you both for jumping on with me. Like I said, I reached out to both of you once I started to get some of the information, because I know, and I'm sure everybody out there watching this is well aware that once someone finds out you're like in the fire service or you work EMS, they automatically have some sort of medical question for you. Mm-hmm. And, I want people to have good information that they can be able to pass along to folks. So I'm just going to quickly read exactly what an excerpt from the FDA release. And then we'll talk about that a little bit, because there's some, I think it's multifactorial, and we'll dig into that a little bit more. But the release said exactly, to be clear, while an association between acetaminophen and autism has been described in many studies, a causal relationship has not been established, and there are contrary studies in scientific literature. That statement was kind of morphed into something that I think could potentially be flirting with being dangerous, and not allowing or making pregnant women feel like they can use Tylenol appropriately during their pregnancy. So I just kind of wanted to talk about that a little bit. So,
well, I think if anything, this entire challenge that we face, frankly, is a good reminder of research and the difference between causation and association, right? Causation is that there is a causal link, right? So there's a cause and effect, right? If I flick the light switch off over there, the lights will come off. If I hit it again, the lights will come back on. That is a very clear cause and effect. A classic example of an association or a correlation, right, does not establish cause and effect. But for example, one that's widely used, right, is that ice cream sales are associated and correlated with the number of drownings. So there are more ice cream sales when there are drownings. Now, is that because consuming ice cream causes drownings? No, of course not. But like it's summertime, so we have more ice cream and we're in the water, right? So that is, if you will, an association that I hope we would all agree is unlikely to be based on any scientific logic to suggest that there is a cause between ice cream sales and people drowning. So as the statement was made, we have to be really, really cautious about that. And there are a lot more layers to this.
Yeah, I don't disagree with that. The other thing, and I was just like, okay, let me take any political thing out of it, right? Like, let me just remove that for a minute. And let me just think about this. Like, let's just say there is at some point, and noted how you said, Mike, was that there's studies out that refute this information. So there's that part of it. But then additionally, I'm like, well, what kind of Tylenol use are we talking about? Is it a gram every 8 hours for the entirety of your pregnancy? Or is it just during the third trimester, which some things suggest? And then they also, then I went like down the whole rabbit hole. I was like, is there really more ADHD and autism, or are we just diagnosing it more or better at testing for it? And then that was a whole rabbit hole of information too. And then there was, this, so I went back and kind of looked at like, what did the FDA base this on? And there were like 2 studies, one, the Nurses Health Study 2, which looked at ADHD, and it was noted as frequent use. And I was like, well, what does that even, like, what does that mean, every day? I was like, I guess. And then they noticed that maybe there's an ADHD increase. And then the Boston Birth Cohort, which looked at cord blood concentrations, and said that they were increased in a kind of in a dose response. Again, there's nothing else for pregnant women to take, actually. You can only tell them to take like 3 things anyway. But I mean, I'm just like, well, maybe they were in pain that last time. I'm just trying to, think about it in my head. And I was like, so I don't really feel like that's been parsed out very well either.
Well, yeah, I think there were definitely some details of that, and as you related to understanding the what type of usage of Tylenol we're talking about, but and not only in analgesia or pain management in pregnancy, but also management of fevers associated with infections, because I think that's something that we've also got to really understand, because when the fetal brain is developing early in in that pregnancy, there's rapid multiplication, and these fetal cells are being produced, and that's when sometimes some of that transcription problem can happen, right? And we know that there's a fairly clear genetic link to the autism spectrum disorder. And so was it there's not enough information, I don't feel like, to say, was it the Tylenol or was it the fever that is really the direct link? And I love the whole ice cream and drowning relationship. That's I'd never heard it explained that way, but that's like a perfect way to explain it. Plus, Dr. Fabiano, as you indicated, autism's being diagnosed at a much higher rate now. We understand more about it, right? We understand that it's a spectrum, and also there are now very fortunately programs to help people who are suffering from different issues on the spectrum of autism. So they're going to want that diagnosis to get access to those programs and that assistance. So I think it's all very multifactorial. I liken it to like cardiac arrest, saying that one thing in cardiac arrest resuscitation is this is it. That's the one thing we have to change, and everything else gets better.
Yeah, Mike, I think something that there's actually a lot of things that you said that I think are worth unpacking for our listeners, right? One is that, as Dr. Fabiano mentioned, right, there are some meta-analyses and other cohort studies that have looked at this potential association between acetaminophen use and autism spectrum disorder, right? Similarly, one of the largest studies done that was published last year in JAMA looked at a population of over 1 million. And actually, I think it was 2 million because it was in Sweden, and had a cohort of almost 200,000 children, and found no association, right, between acetaminophen use but I think acetaminophen use, as you suggest, or paracetamol for any of our overseas listeners, right, is just part of the story here, right? Because and this is where association and causation are extraordinarily complex, and it is not as simple as one exposure is resulting in this problem, right? Because you mentioned something, and I do think it's really important for us to acknowledge the fact that we know that maternal fever in the first trimester can cause all sorts of bad things, actually. So there is identified links and risk factors for neural tube defects, for heart defects, for facial oral clefts, for some other serious birth defects that are associated with fever in mom during that first trimester. And so, to suggest, well, sorry, moms, you just need to, quote unquote, tough it out, I think falls well short of the fact that we already have a very well-established, not well understood, to be clear, right? Not well understood, but well-established set of risks that fever, particularly high fever in the first trimester mother, is associated with things that are developmentally related. And so, of course, there might be some Tylenol use there, right? Of course, mom may have taken some acetaminophen. Is there a cause and effect? We don't know. And I think that's an important consideration with all of this. The EMS analogy that I would give, right, is that I think we would say that endotracheal intubation is associated with death, right? Because who gets intubated? Right?
A lot of really sick people.
A lot of really sick people. A lot of people that are already dead, right? But we intubate them, right? But hopefully we would all agree that no, certainly if you put the tube in the wrong place, all those other things, yes, there is a direct association, but you get my point.
Right.
Yep, for sure. Dr. Fabiano, did you have anything else you wanted to say or add?
I would say, we need more information. I would say I wouldn't take IV Tylenol, oral Tylenol, rectal Tylenol off the medication list anywhere. It's those old pendulum swings that we see all the time, right? Like lidocaine was in vogue, then it was out of vogue, then it's in vogue, then it's out of vogue. Same thing with steroids, right? In vogue, out of vogue, back in it, that kind of thing. And I just wouldn't take it. Would I tell a pregnant lady and, the key parts of her third trimester to load up on Tylenol 3 or 4 times a day? No, probably not. But, would I scale it back to 650 maybe instead of a gram? Yeah, probably. But I don't think we can just jump on changing a bunch of protocols or anything like that based on this kind of stuff. So.
Yeah, I'm with you, Dr. Fabiano, right? Acetaminophen, for the indications and the dosing that we are giving it in the field, right. There is a massive body of evidence that indicates that it is absolutely safe,
right.
for a pregnant female or anybody else that we are giving it to. I mean, my folks are giving
right.
IV Tylenol like it's water.
Oh, I know.
For analgesia, and it's a great drug. It's a phenomenal drug, and I think we have literally millions upon millions of encounters. So I'm with you. There's no need to take this off. The challenge, of course, is that when you have that preeclamptic female with a headache, right, or gravid female that has a fever, of which we know that. Again, fever in the populations are bad. What are our options? And this is another part of this debate that I think is, probably not a debate, but part of the conversation that is important, right? Because really, what else do we have? Okay, well, we have aspirin, okay, but we know that there are risks associated with that. Allergic reactions, ulcers, bleeding risk, although low. There's lots of drug-to-drug interactions with aspirin and a bunch of other things. We do know that aspirin is safe early in pregnancy, so I don't want everybody to run away and go with that. And we certainly do some things with that. But for the reasons that people would take Tylenol, meaning fever or analgesia, aspirin is not only probably not going to give you any relief, but there's actually a little bit more risk. Let's look at ibuprofen, right? I think we all know ibuprofen. Well, again, specifically in pregnancy, right, it absolutely is well associated with miscarriage or implantation complications during basically periconception periods. Certainly in the late third trimester, right, we worry about premature duct disclosure and so forth with it. Not to mention that it's past through the placenta, so you can have some fetal renal dysfunction and so forth associated with that. So, when we think about these things, what are the alternatives? And the answer is, if it was my wife, we would be taking acetaminophen, because the risks of the alternatives, in my opinion, far outweigh the association through a relatively questionable methodology, meta-analysis, that suggests that, again, there's an association. And to be clear, there is no evidence of causation that the scientific literature has been able to. It doesn't mean that it doesn't exist. It just means that we haven't figured out what that is. And it isn't a gross oversimplification of a really, really complex. There's certainly a genetic component. There's a lot of environmental conditions and others that are believed to lead to autism spectrum disorder. But I think in the end, it's probably something that ends up being very similar to cancer, right? So we always talk about, well, we need a cure to cancer, but there's literally thousands, if not tens of thousands, of different types of cancers. They're all very unique pathologies, even though they all result in the same challenge to those that are in there. And it's been very, very difficult. And statements like this, that Tylenol is what causes it, and women just need to tough it up and deal with it, really closes the opportunity to do the work and the research that's necessary to identify those causes for autism and autism spectrum disorder, and support both mothers and children through all that.
Agreed.
Awesome. Very, very well said. I think so. I think the kind of the overarching takeaway from this is, pregnant mothers, feel free to use acetaminophen or Tylenol as prescribed or as directed, following those recommendations, kind of full stop, because there's really not any information to say otherwise.
Right.
I thank you both for your time. This has
Awesome.
been great to get to sit down with both of you. And I was happy because both of you jumped at the opportunity to come in here and talk about this. This is a fairly short video, so it allows us to get some of that good information out there. So I thank both of you, and continue to thank you every day for all you're doing to push EMS forward. You both are doing some amazing things, and I'm really excited to get to collaborate with both of you. So thank you.
Awesome.
Thank you, Mike.
Thank you.
Fabiano.
Bye, Dr.
Have a great day.
Be good.
Bye.